Hey guys, my name is Jen. I guess I'll kind of go over our infertility history and then update everybody on my last cycle because I kind of went silent on the blogosphere. We have male factor infertility. Hubby has low morphology. They are starting to learn that I have low progesterone. We have been trying for almost 6 years. We had a miscarriage a few months into our marriage back in January of 2008. Haven't been pregnant since until we got better insurance and started up fertility treatments in January. I saw an RE end of January, did our first IUI in February. Technically it was successful. But I miscarried or had a chemical pregnancy, whatever you want to call it. My betas kind of went up and down and up and down and up and down and drug on for about a month before I started bleeding. And they realized then that I had low progesterone, or, it could have just been a sign from the get-go that this was not going to be a healthy pregnancy. I think I have low progesterone. I always spot prior to my periods. But that's just my theory. We did a second IUI after my beta got to 0 and I had another cycle. That was negative. Didn't have any spotting on the progesterone. Then we did a third IUI and I started spotting at 10 days post IUI. And just fully started bleeding 12 days post IUI, even on the progesterone supplements. So I called and was very upset, and they decided they would switch me to Chronome. Let's see, they also checked my progesterone levels and things like that, which they were in the toilet by then, so it didn't really matter. We went ahead and did an injectable cycle on the 4th cycle, which is where I fell off the blogosphere wagon. Someone donated me a cycle's worth of Gonal F, so that's what we used. The Gonal F made me extremely sick. I think I threw up every day at work. That was fun. What else? We did another IUI. The lowest number, but just barely by like 0.3 million, I think. I did the Chronome this time, or that time. This was back in June. And everything went well until 10 days post IUI again. I started spotting, was pissed to high heavens, called the doctor. The nurse called me back. Basically, there's nothing we can do if you're spotting. You may just be starting an early period, yada yada. I kind of yelled at her because it's the nurse I don't like, and told her that they didn't care, that obviously something was wrong. It's not normal to start your period 10 days post IUI, especially on progesterone supplements. And so they had me come in and do a bunch of blood work and an exam and an ultrasound, and my uterine lining was like a 12 or 13 on day 11. And then my blood work came back and my progesterone was like 1.1, I think. Negative beta, or maybe it was day 12. I think it was day 12 that I finally went in. So they did a HCG and it was negative. So I stopped the supplementation, of course, started full flow immediately. That day that I went in, they also saw that I had a cyst on either side, because I had that 4th cycle that I was on Gonal F, I had 3 mature follicles, another 4 that may or may not have caught up and ovulated, and then another 7 or 8 that were immature. So it didn't surprise me that I had huge cysts on both sides. I didn't hyperstim per se, but my ovaries, they said, were 3 or 4 times the normal size. They were like 7 or 8 millimeters, I think. or centimeters. I don't know which one. So that was extremely painful. So obviously we were going to have to sit out July regardless. Of course, my doctor was out of town on vacation, because that's what people do in the summer. And so when he came back on Monday, he said, I really don't think you have a progesterone problem. You are on progesterone supplements. So I don't think that's why you're bleeding. There's got to be some other reason. Which I don't know that I believe that. But he wanted to do a histogram or whatever that thing is called, where they put the camera up your hoo-ha. And they decided to do a lap also, just to see if there was anything going on, since we were obviously taking the cycle off. Insurance was going to cover most of it. So I had that done 8 days ago. And the surgery itself went really well, pretty fast. He said that he found very, very, very mild endometriosis. I myself could only see 1 or 2 spots on the pictures that he gave me. And I actually have a friend that is a scrub nurse for those. So she kind of went over them, looked at them to see what she could see. I'm trying to dig them out, see if I can show you the pictures. Let's see. The lighting in here is horrible. Let's see. I don't know if you can see this or not. So that's 1. 2. And 3. So the surgery itself wasn't bad. I was really, really worried about anesthesia. I've never been under general anesthesia before. And anytime I've had any type of dental work, they always had to give me extra anesthesia. My wisdom teeth, they couldn't knock me out. So I was really worried about that. They gave me an anti-nausea patch or whatever, like a seasick patch that you put behind your ear. And I don't remember anything in the surgery, so that's good. The recovery has really sucked. I had a lot of vomiting the day of the surgery. Peed myself a couple of times. That really sucked. My husband scrubbed the bathroom after that. I felt really horrible, but he said as long as it wasn't the bed or the carpet. So that can happen. Those are things people didn't tell me, that you'd throw up. My shoulder also hurt really, really bad. That's something nobody told me also. That lasted about 4 days. Sorry. I had a very, very sore throat for 2 or 3 days. No one warned me of that either. I didn't even think about it. Ice cream helped a lot. The only thing I could really eat was ice cream and soup and mashed potatoes, because everything else I just vomited. My husband was really stellar. I did go back to work on Monday, mostly because the doctor didn't give me any time off and I don't have any sick leave. And the pain, the gas pain in my chest, like right where my sternum is, has been awful. That lasted day 4, 5, 6, and 7. And today I'm finally starting to feel some relief. I took the Percocet until about day 6, and someone told me if you stop taking it, that'll help with the constipation. I don't think it did at all. I've been taking laxatives like they're candy, and I'm still constipated. I'm still really bloated. But I'm finally starting to feel a little bit better. I mean, my stomach hurts today, but I'd rather have that than feel like an elephant is sitting on my chest. So, warning to those of you that have to have a lap done. It is not fun. Of course, a bunch of people that I talked to prior to the surgery told me, I had it done Thursday. By Monday, I was totally fine, in no pain, on no pain medicine. And for me, that was definitely not the case. Come Monday, I still really hurt, and if I had had my way, I probably wouldn't have gone to work on Monday. maybe even Tuesday, but I'm definitely starting to feel better now. So I still plan to take it easy this weekend. Now that it's Friday the 26th, my surgery was on the 18th. So my post-op is not until the 7th. So the 7th I see the doctor and we'll find out exactly what happened in surgery. He typically doesn't come in and talk to patients post-op, but I asked if he was going to come in, and he wasn't in surgery. I was the last surgery of the day, so he came in and just kind of gave me an update. I remember about the endo, but I don't remember anything else really. He did say that we were going to do progesterone and oil next cycle, just to make sure that I get the proper supplementation, because clearly the vaginal support is not working. And he said there was something else, but we would talk about it at the appointment, and I have no clue what it is. I cannot remember to save my life. I only have 6 vials of 75 units of Gonalef left, so what, 450 IU, and then I have a vial of 300 IU full stem. So I don't know if we'll do a Clomid Gonalef cycle or what. The first 3 cycles were Clomid, 50 micrograms, and I think the first cycle I had 3 mature follicles, and the others I had 2, I believe. So not much worse with the Clomid, except for it did thin my lining just a little bit. So I guess we'll find out on the 7th where we go from here. We really only have enough money to do 1 more IUI, because insurance thankfully covers all the ultrasounds and blood work and everything, but they don't cover the actual IUI. And then the surgery, all I had to pay was my deductible, which is only $500, so that was good. But and now that I've met my deductible for my surgery, I believe that, what's it called, injectables will be covered 50%, so I may go ahead and get the other Gonalef. To have a full injectable cycle again. I don't know, because it made me so sick. But I don't know. I guess we'll see on the 7th. I'll definitely update you. But I have been thinking about video blogging for a long time, so I just wanted to kind of start. If you guys have any questions, feel free to ask. I'll be more than happy to answer any questions that you have. Trying to think of anything that I haven't told you. I'm 27. Husband turns 32 next week. Have 2 fur babies. Been married almost 6 years, trying the whole time. We are approved to adopt through the foster care system. That I'll just update on later. That's a totally different video, but if you have any questions, let me know, and thanks for listening.